So do dentists in the UK actually make good money? This is one of the most common questions that I tend to get asked, and the answer isn't as straightforward as you may think. In this video today, I'm going to be delving into the pros and cons of dentistry, NHS dentistry versus private, the real earning potential of both, and the pitfalls that you need to be aware of. Hi, my name is Dr. Minho, and I'm a dentist based here in the UK. And on this channel, we're going to be discussing everything from dentistry to money and overall financial independence. So if that's something that interests you, hit the subscribe button below and let's get this video started. So let's start this off with the short answer. And the answer is yes. Dentistry is a well-paid profession here in the UK and across the world. However, there's a lot more nuance to it than just that. It depends on how you work, where you work, the level of experience that you have within the field of dentistry, and whether you're in the NHS or whether you're in the private sector. All of these factors have a huge influence on your earning potential. Now, let's break this down properly. So if you're working in the NHS, you can typically expect to earn anywhere between £50,000 and £100,000 based on an average 4 to 5 day work week. Now, to most, that may sound like a really good income. However, the NHS does have its limitations in terms of what your earning potential can be, and you're limited by what we call the UDA, or Units of Dental Activity system, that we use here in the UK. Now, we won't get into the details of this system, but it definitely has its limitations, and you are limited to how much you can potentially earn within this system. On the flip side, you have private dentistry. Now, within private dentistry, your earnings are uncapped. An average within the UK would be between £80,000 and £150,000. However, this can scale to whatever you'd like it to scale to. I have colleagues who are earning £400,000 to £500,000 a year in the private sector, doing higher level treatments such as cosmetic dentistry, Invisalign, implant dentistry. So it depends on where your skill set lies. However, within the private sector, you are free to scale your earnings as far as you'd like them to be. And this is the flexibility and freedom which most dentists aspire to achieve. Now, most dentists will work somewhere in the middle. They will have their NHS obligations and they will also have their private patients. And so that's what's known as a mixed associate dentist. Now, mixed associate dentists will earn anywhere in between the figures that we've just stated. So we'd say anywhere between £80,000 to £120,000 pre-tax. So to give you some context, here's how dentists compare to other professions here in the UK. As you can see from the table, dentistry clearly sits in the upper to middle high income range, similar to doctors, lawyers, and engineers. It's not necessarily the highest paying career out there, especially when you consider the level of training and responsibility involved. You have to study 5 years at dental school and then 1 year additional training. And if we zoom out and compare globally, it gets even more interesting. Dentists in countries like the US, Canada, and Australia tend to, in general, earn a little bit more than in the UK. So while dentistry in the UK does pay very well, it's not actually the top globally. So what is the reality behind these numbers? When we talk about £100,000 a year, £150,000 a year, you will inevitably think that's an amazing salary to achieve. However, dentistry does have many costs that are involved. You have your laboratory fees, you have your very expensive annual indemnity insurance fees, and the biggest one, taxes. The more you earn in the UK, the more you are taxed. And as a dentist, you are self-employed, and so you aren't taxed at the point of earning, you are taxed later on when you file for your self-assessment. And so there are lots of fees involved with this process. And so even though the top line may look amazing as £100,000 or £150,000, once you've taken into account all of these fees, what you're left with at the end as your disposable income is a little bit more limited. And beyond that, dentistry is a very physically and mentally demanding job. You're constantly dealing with patient expectations on a daily basis. You work in a confined space, and for many, it can be quite a lonely profession because you're alone, potentially with one nurse there throughout the day in a surgery from 9 till 5 or whatever your working hours may be. And so this can be quite a limitation within the sector. I'd just like to touch on the notion of golden handcuffs. This is experienced by many professionals, many high-earning individuals, and this is the notion that when you start to increase the level of income that you earn, your lifestyle also starts to follow suit. And so you may invest in a nicer car, a larger house with a bigger mortgage to pay. You may start to send your kids to private schools. You'll start to shop at M&S and Waitrose as opposed to Aldi and Lidl. And what this does over time is called lifestyle creep, where even though your income is increasing, your lifestyle is also increasing in line with that. And so the amount of overall freedom and independence that you achieve actually diminishes or stays stagnant. And so this is something that's really important for not just dentists, but any high earning individual to really come to grips with, because unless you can maintain a level of lifestyle which is reasonable, you will always find that you are making ends meet. You want to ideally be in a position where as your income grows, your lifestyle stays the same or maybe grows at a much slower rate. And the gap in between your income and your lifestyle can then be used to either save for future investments or just be a bit of a cushion for you so that you have that level of financial independence. Without you having that difference between your income and your expenses, you will always be in a position where you are having to work. And that's not a position which many people would like to be in. One of the biggest lessons that I've realized recently is that income isn't everything. And that even if you continually increase your income, it will not bring about the level of freedom that you aspire for, especially if that income is being generated from a day job. Now, dentistry is one example of a day job. For me to earn, I need to be in the clinic treating patients and generating revenue. Real freedom comes when you have multiple income streams. And this is something that we're going to be touching on quite a lot within this channel. So if this is something that really interests you, hit the subscribe button. In future videos, we'll be touching on how we create multiple revenue streams, which avenues in 2026 we should be looking at, and what's realistic alongside a day job. What sort of side hustles are realistic. So overall, do dentists make good money here in the UK and across the world? Simple answer is yes. We do make good money. There are many factors involved, as we've discussed. So if it's a career which you're looking to get into, drop a message down in the chat box and I can always get in touch and give you some advice on any other questions that you may have. If this content is something which you are interested in, don't forget to hit the subscribe button below. Like, share, pass this around to anyone who you think may enjoy the content, and stay tuned for more coming soon. See you soon.